Greetings and salutations, everyone. Thank you for tuning in to the Her 5 podcast. This is episode 3. We have a great topic of discussion today. We are talking about Minority Mental Health Awareness Month. Our goals of our podcast today is we're going to be normalizing conversations about mental health in the minority communities. We're going to highlight the cultural stigmas and stimulate and systemic barriers. We're going to share personal experiences and personal and professional insights and offer resources and strategies for healing, advocacy, and support. We have 4 of her 5 members today. We have me, the nurse practitioner. We have Marissa on board here, our health and wellness coach. We have Angel, our MBA and veteran, and we also have Ashley, our respiratory therapist. So let's jump into what minority mental health is. So it was officially recognized initially as the B.B. Moore Campbell National Minority Mental Health Awareness Month. So B.B. Moore Campbell, she was an African-American author, journalist, and teacher who had 3 best-selling books according to the New York Times. She was also an NAACP Image Award as well as the National Alliance of Mental Health Outstanding Literature Award winner in 2003. It was mainly for her best-selling book, children's book called Sometimes My Mommy Gets Angry. So all of her books that she wrote focused on mental health illnesses in the Black and Indigenous population. So it was 2 years after her passing, in May of 2008, the U.S. House of Representatives announced that July would now be Minority Mental Health Awareness Month. So we celebrate and recognize it to bring awareness to unique mental health challenges and barriers that faced by the racial and ethnic minority communities. Well, why does this matter? So we're going to be taking a deep dive into the unequal access to care. So minority populations often face greater obstacles to mental health services due to systemic racism, economic disparities, cultural stigmas, and the lack of cultural competent providers. We also have a cultural stigma in silence. Many communities of color, mental health is a taboo topic. We don't want to talk about it. Silence leads to suffering and also leads to untreated mental illness and that worsen over time. We're also misdiagnosed and there's many disparities. Minorities, individuals are more likely to be misdiagnosed or underdiagnosed, particularly in disorders like PTSD, depression, and schizophrenia, and often receive inadequate or inappropriate treatment. Also, the lack of diversity in mental health professions can lead to communication gaps and mistrust and misdiagnoses. So the Mental Health Awareness Month encourages efforts to diversify the mental health workforce, improve care for all others. So let's jump and talk about disparities. What does that mean? So the Office of Health Equality in the United States, they define health disparities as the preventable, that's the word, preventable factors and differences that disproportionately affect certain people and groups. They contribute to health consequences because of disease, injury, or violence, and lack of prevention opportunities. So there's many factors there that affect or are disparities. There's your income, there's your social economic status, your race, and your ethnicity. And there's many others. Can anybody help me out?
Even your age or sex or gender, geography, like where you grew up or where you're from, even disability sometimes.
Yes, for sure, for sure.
And specifically now, since we got all this like immigration stuff going on, that's a big thing right now.
Yes, that is a big thing for sure. And then,
It
you know,
is.
religion too.
Yeah.
Yeah.
That's a big one. So historically, these characteristics have been linked to discrimination and exclusion. So when a particular group of people, they don't have the same kind of access to healthcare, education, or behaviors, it can cause them to fall behind their peers of all kinds of health measures. And these disparities can often persist for many generations. So there's some statistic out there, according to the U.S. Department of Health and Human Services, the Offices of Minority Health, there's a interesting statistic. In 2022, suicide was the third leading cause of death for Black or African American ages 10 to 24. Anybody else?
Yeah. The death rate for suicide for Black and African American males were more than 4 times higher than Black or African American females in 2021. Black Americans living below the poverty level as compared to those over twice the poverty level were twice as likely to be reported to have serious psychological distress.
Mm.
Also, in 2023, Black adults over the age of 18 who received mental health treatment was 15% versus the white counterpart as 27%. And the Black adults over the age of 18 who received mental treatment with medication was 7.7% versus the white counterparts at 20.6%.
And that's disturbing. So these statistics, so we know that mental health is a serious period. It's serious. So, but especially with that suicide, these are crazy numbers. So we want to jump into personal reflections. So for me, mental health, period. So personally for me, I have anxiety. I self-diagnosed first. I was like, I can't, you know, nursing school gave me anxiety. There was the fear of failure. There was the fear of, me not passing, me, wasting money. Like I went to school, now I failed out. Now all my money gone. Now I have to start all over. Like all of that was running through my head. And so I actually got help. I actually started going to a therapist or a counselor. I wouldn't call her a therapist. She's a counselor. And just having that unbiased party, like I feel like I can bounce off ideas or I can vent to her and she can give me some tools or some strategies to help cope with that. So I do remember one time, like my anxiety was on 100 and she gave me this worksheet. She's like, okay, this is the stressor. And in your mind, you have to work like, is this going to kill me? Is this like, what are the actual repercussions to failing? Like, trying to lessen the blow, lessen the anxiety. So,
Right.
anybody else got something?
Yes, I am so deeply passionate about mental health because I didn't know that I had a mental health issue until I was in my 20s, and mine was different. It wasn't just school. I had a lot of stuff growing up, and so I went and saw a therapist, professional therapist, and I realized I had some childhood trauma. I mean, it wasn't like my parents did anything to me or anything. It was just, I grew up in a really religious background, and and it wasn't just, I'm not blaming it on religion or anything. It was just some stuff that they did the best they knew how. And so when you become an adult, you you have to take responsibility for what's going on. You can't be the victim and be like, well, they should have did this or this. No, you got to take responsibility for it. And I'm glad God made me who I am because I have 3 brothers. And when we were growing up, I mean, they were taught not in a bad way. I don't want to say it's in a bad way, but like y'all know, men are not supposed to show emotions. They ain't supposed to cry. And that's why a lot of men commit suicide because they suppress until they feel like they better off not being here.
Yes.
And so they kill themselves and they don't feel like they have a safe space to talk to, even when they're in a relationship or marriage. It's just like, I don't want this person to see me as a weak man or soft or whatever. So they just suppress it. And they was raised not to talk about it. And that, I mean, I don't want to take too much of the time because I was gonna go into something else. But yeah, seeking help is like the greatest thing ever. And if you don't feel like you have a safe space, you have to create it.
Right. Yes. That is so true. That is so true. What about you, Angel?
Yeah. Now, I have never seen a therapist, okay? Never seen a therapist. I've thought about it, but I've also done my own research to where I can kind of help myself get out of, I wouldn't say a mental health crisis, but you going through some things and you kind of, you get your diary or journal and you write it down or you talk. I talk to my mama about a lot of things, and she is one of those people where if I'm having a bad day or something is just, I feel like my world is falling apart or I'm going through anything. Like, my mama is my therapist, so that's probably why I've never actually seen a therapist. But I would, but she is. Like, my mama will pray with me.
Mm.
She'll, call and check on me or whatever it is I need or I think I need to get through whatever it is I need to get through. Then that's my girl, you know. And a lot of people don't have that. You know what I'm saying? They don't have somebody that they can go to and sit with and talk or just call on the phone because I ain't here no more. So, call on the phone and they get you through whatever it is that you're having trouble with. So,
Right. I totally agree. Because
That's
I feel like if you bottle it all up, one day you're going to explode. Yes.
yes, yes,
For sure. Even if, you just need to vent, a lot of times people, they don't know whether that person who comes to them that they want to fix the problem or they just want them to listen. Like
yes,
half of the
yes,
time, I just want you to
yes,
listen. Like I
yes,
just want to vent,
yes, yes. Just listen. Let me get this out.
Yes.
that you
Let me get this out.
that's good that you said that because, like you said, people don't know. So when people do come to me, I ask that. I'm like, do you want my opinion or you just want me to listen? I think
Yes.
a very good point.
Yes.
Yes.
I start to learn that because I don't know when me and my husband are talking, I'm like, you want me to fix it or you just want me to listen? And then vice versa. So I learned from him. So when people come to me, I'm like, okay, you want my opinion or you want me to try to help like fix it? And
Mhm.
so that really helps a lot because some people they just, they don't want you to fix it. They just want you to just listen, because you need to
Yes.
get it out. Because I guess venting is, I guess, in lieu of like journaling for people who don't have or people who don't want to go to somebody. You can just write it down, and that's your way of pouring it out, you
Yeah,
know.
that's a good way. And also I learned too, like if you don't have a person to go to or you journal, you can video record. I do that now.
Really? Okay. Yeah, that's a good one too. Yep. I
Yeah.
didn't think about that. I didn't think about that.
I
Video.
I be motivating myself. I be like, look, sis, you got this. You're gonna have be doing it something.
Exactly. Wow, that was good. I like that. See, I learned something like blogging or, just videoing. Okay, that's another avenue that we can, add to the mix. Okay, so let's jump over into our personal. I'll go first. So mental health in healthcare, or more importantly, into nursing. So there's a lot of burnout that we see in healthcare. I remember when I was starting going and thinking about going into nursing, they said that there was going to be a demand before the year 2025 or something like that. And that was like 10 years ago. And now we are short nurses. And so I feel like back in the day, there used to be a 3 shift, 7 to 3, 11 to 7, 7 to, whatever. But now we're working 12 hours and that can play a toll. And then coupled with that, the patient to nurse ratios increased. So a lot of places, of course, where we work can be up to 6 patients. And depending on the acuity of these patients, that can be a whole lot. So for me, when I started working in my long-term acute care facility, I always had 6 patients. And by the I worked 3 12s in a row. And by the second day, like I am like exhausted. Because go in at 7, get off at 7, hopefully, and then you gotta take a nap and then do it all over again. So you really don't have time to really reset. So with that kind of burned me out for a little bit. And then you have to know when to take time for yourself. Your mental health is important because if you're not together, how can you take care of other people? So taking a break for yourself, taking a vacation, if you know that you know, you fed up, take some days off. I know I had to do that a couple of times. So, um, anybody else got something?
Yes, from like the standpoint of a respiratory therapist, we work hand in hand together with nurses, and for my patients, I ask them, I get personal with my patients because I really, honestly and truly, like I try to take care of them like if like my family member was in there, especially like when I know like they don't got nobody, it just softened my heart even more. But I'll talk to them and I'll say, when did you start smoking? Because most of my patients got, you know, they start like that or whatever. And I ask them, when do they start smoking? And I've even heard somebody say 6 years old.
What?
6 years old.
Uh-uh.
Like,
Wow.
this 2025, but back in the day, cigarettes wasn't, they wouldn't, they was easy to get. You could just walk into the store, a little boy could get them, for their daddy. It was just different back in the day. I've heard the youngest 6 years
Yeah.
old. And so, people try to find outlets to cope with whatever they're dealing with mentally. And so it starts with a cigarette. Then it starts with alcohol. Then it starts with whatever else. It can lead to other drugs, but a lot of my patients start like that, and once you get to know them and they see that they got a space to talk about something, they'll reveal to you. You can like just listening to them and just paying attention, they'll reveal to you like, oh, this happened to me and that's when I started smoking and blah blah blah, this and that, and then they got a chronic illness now.
Right. Right. And illness can sneak up on you too. And a
Yeah.
lot of illnesses are like silent killers, like hypertension, kidney disease, you just never know until it's too late.
I just like,
Yeah.
oh, how deeply I just wish they poured more money into mental health. That
Yes.
like with medication,
Yeah.
it would fix so much stuff. Like people would live longer. They would wanna take themselves more if they just had a freaking safe space to
Mhm.
talk about stuff. I feel so strongly about that. So strongly about that.
Me too. I feel as though there should be in every clinic or every primary care, there should be like a mental health person
Mhm.
on staff. Like
Yeah.
that's like people go in every 3 months for their diabetes or every 6 months for whatever. I feel like they should have mental health check-ins. That should be like a requirement. You shouldn't have to have a referral to go to like
Yes.
behavioral health. This should just already be mandatory. Okay, you
Oh,
coming into your PCP.
You're
Okay,
right.
now let's hop over. And then some of the stuff, like after you're dealing with say, I don't know, your husband died, your child died, or whatever the case may be. Some of the stuff comes to be somatic after that. Well, now I got a headache. Now I have a stomach ache. Your stress you get stress ulcers from this, like for this
Mhm.
very reason. So I feel like that should already be on campus, on site, a mental health, behavioral health person. So when that person comes in and they're having all these issues, they should just jump over to the counselor or the therapist. Like it should be readily available and not, okay, well, you have to have insurance, you have to be referred, and it's just so much. Like I feel like I agree with you, Ashley. It really we need to pour more money into that versus other things.
I think we also need people that look like us. We need people because you can have a cultural difference. You can be talking to somebody. I think it's highly important to have somebody look like you. You can be talking to somebody and tell them experience, but if they culture don't experience that, they not gonna understand. It's not gonna be relatable. I just learned that from going to therapy. I've had different races with therapists. I prefer what I prefer, and I know that I feel more seen and heard when I have somebody that look like me. I think representation matters.
Yes, it does.
yeah.
I totally agree. So my counselor, so when I got referred for a counselor and then I was looking at their website and trying to go through who I wanted to pick. And at the time, I was in Huntsville, so that particular facility only had so many people of color. And so I wanted to pick a Black female, but that particular counselor was booked up. So I was going for a person of color, but now I have a white female. And I mean, I love her, but I
Mhm.
feel like I am censored in some topics that I really want to discuss.
Mhm.
So I can't really go in depth with some things because she might not understand. So but all in all, she's helped me out a lot. But in the back of my mind, I wish I could have a person of color, that a person who looked like me. But I feel like she's culturally competent enough, but it's still, I feel like I can be sent. I can't say certain things
Right.
mm, with her. So, what about you, Angel?
Well, you know, uh, as y'all talking about, the healthcare part of it, but as the service member part of it, soldiers face unique mental health challenges every day. Is
Mm.
due to maybe high stress, trauma, demands of the service, whether you're in the field for several days or you're deployed and you're away from family and friends, and you know you might be in a hostile situation. It's all kind of stuff that soldiers deal with, um, especially with their mental wellness.
Mm.
Um,
Mm,
Soldiers can deal with mental health by acknowledging it, because let's be for real, you're a human before you're a soldier. Period. All day long. So, recognizing pain or trauma is not a weakness, it's strength and it's self awareness, knowing that you're going through things and you need help. There's nothing wrong with wanting help.
right.
So you just have to get them. I mean, and it's a lot of resources, right? So, soldiers there's a lot of things they can do to get the help that they need so they can keep pushing.
For sure. Mm-hmm. Um, so let's talk about breaking the stigma and barriers. So I've already talked about my whole deal with my therapist. Um, I suggest going to therapy or like we said earlier, journaling, videoing. Um, but
Talk,
what you said what?
talking to a friend.
Yes, of course, for sure.
Oh,
Representation, trying to get the providers that look like you, that will have a better understanding. Um, let's see what else. And then not a topic that a lot of people like to talk about, but developing a faith, going to church. Sometimes that's a person's solace, if they grew up in the church, praying to God to give you strength to, you know, help get strategies for you to improve your mental health. Those some things
all
too.
right.
Anybody else? So what are some stigmas we've had to unlearn? So
Hmm.
I
Oh,
so unlearning. So when I was like a teenager, the whole stigma, everybody was like, you going to therapy? You crazy? What's wrong with you?
Like,
oh, right.
Yeah, so that was for me.
Therapy is not just for crazy people. It's
yeah,
for people who want to heal, grow, or understand themselves a little bit better.
yeah.
Another stigma is talking about it is attention seeking. Because you mean to tell me just because I'm talking about my problems, I need attention from somebody?
Yeah.
No, talking about it is brave. It helps break the silence for others to talk about it too.
Right.
One of the stigmas that I had to learn, I'm still learning. I mean, I know it, but I'm still grasping onto it. Is being sensitive is a superpower. Be,
Yeah.
you can be sensitive,
Yeah,
and some people are sensitive because they suppress stuff for so long, and now it's coming out. So it's just you hear people say, "Oh, that person's sensitive." No, that person has feelings and they're valid.
Right.
right.
Yeah.
They have value.
Yeah.
Exactly. That's so true. So another some practices and some barriers, we can set up boundaries for people. Sometimes you got to feed people out a long handled spoon. If some people, like, they give you bad vibes, they give you bad juju, give you bad energy. They're always negative Nancy. They're always doing this. Sometimes you just have to set boundaries, because the more you hear negative stuff, like, that plays a toll in your mental health as
Yeah.
well. And it can be a friend, it can be a family member, it can be a coworker. Sometimes you just have to set boundaries. Um,
Yeah,
or remove yourself from that friend group,
Mhm.
or remove yourself from that job, because your sanity is important,
Mhm.
for sure.
very much so.
Also, affirmations, self affirmations. I learned about affirmations when I read the book The Five Love Languages. I believe it's by Gary Chapman. I may have the wrong author, but I read that book like a long time ago. So I learned a lot about affirmations. Some people need to be affirmed, like, hey, you're doing a great job, you can do this. And some people have learned to self-affirm. I've heard that you can place sticky notes on your mirror in the bathroom. You are beautiful. You can
Hmm.
do this. We can start, another day. Have a good day. That's for your mental health as well. Angel, did you have something on
Yeah.
affirmations?
Oh, like a mental health affirmation that yeah. And it goes like this. I am at peace with my mind. I honor my emotions without judgment. I release what I cannot control and focus on what I can. Every breath I take grounds me in the present moment. I deserve rest, healing, and clarity. I trust myself to handle whatever comes my way. I am not my thoughts. I am the calm observer behind them. I am growing stronger, more balanced, and more resilient every day. My mind is my friend. I am safe, I am enough, and I am healing.
Mhm. That's so beautiful, Angel. I love that.
Yes.
Words. I felt the energy when you were saying it.
Yes, bro. Send it to
Yeah,
me.
I got you.
Yeah, send it to me because I'm probably gonna print it out and put it on my mirror in the bathroom and recite it. Because words are powerful.
Yeah.
So the tongue is so powerful. You can speak things into existence. So if you speak positive things every day and affirm yourself every day, you're gonna be waking up feeling good. You're gonna be affirming everybody that you meet. You'll have that positive energy. But if you are constantly saying, I'm not good enough, I'm not strong enough, I'm not smart enough, whatever, that becomes like your reality. So your reality needs to be positive and affirm yourself in positive ways. I love that, Angel. I love that. Yeah. Don't forget to send it to me.
I
I think
got you. It's sent.
like have your subconscious mind that has like a negative voice. It's like little whispers, and you don't realize it because you're just going day by day or whatever. But like how Angel said, you got like you say those things to you, it's like building that muscle. So those little whispers, they get knocked out the way when you reading that stuff and filling yourself up with that positivity.
Yes.
Yes.
I love that. I love that for sure. So also our barriers, we want to grant access to healthcare. Now, a lot of people don't have insurance. So that means um, they're not going to be able to go to hospitals, urgent care. They feel like they can't get the care that they need. So there are some nonprofit clinics. You just got to search for them. Internet. You got to go to the internet. They will serve you for low cost or free care. Also, there are community, like junior colleges that I'm familiar with, that like cosmetology, the dental hygiene programs, even universities, their students provide care. So I remember when I was in nursing school, the dental program, they provided free dental cleanings. And cosmetology also, when I was in school, they were notifying everybody that you get like a free haircut or a free wash or whatever. So dental stuff. What else? I can't remember. But I do know that those resources are out there. And I'll have to find. So when I was in my clinicals, the nurse practitioner had a list of nonprofit clinics for people to go to get like their wisdom teeth removed or like a simple same day surgery. They were able to go and get it done low cost or either free. So we have to find those resources for people so they can go in. Also, the emergency rooms, those are free. They have to give you care. And let's see what else I got on here. Anybody have anything else?
Um, it's this website that's called psychologytoday.com. If you want to find a therapist, like if you want to scan through a whole bunch of therapists to find somebody that look like you or that has something specific that you're dealing with, like if you're in the gay community, LGBTQIA community, whatever it is, religious, whatever, you can scroll through there and you get to see a picture and you see their credentials and what they're skilled at, and it shows like their how much they charge and if they take insurance. And some of them, oh, and then betterhelp.com, they should sponsor our podcast.
Yes.
I found a therapist on there, and then not to I know every therapist don't do this, but my therapist that I had found on there, we wound up talking outside of that platform, and I started just taking appointments like outside of BetterHelp, and it was more affordable for me that way.
Okay. Well, that's good.
Okay.
I
Okay.
didn't even know that. Angel, you have anything else?
Well, for my military personnel and veterans who are experiencing some type of mental illness or crisis, they can always call a confidential hotline that's available 24/7. You just dial 988 on your cell phone or home phone. I don't know who still got home phones, but if you got one, you just dial 988 and then press 1 And you can also send a text to 838-255. Other resources is the Military One Source website that provides confidential support, counseling, and other resources for service members and their families. And then you also have the VA, and other organizations like the Wounded Warrior Project, Given Hour, and the Cohen Veteran Network also provide specialized care. So there's a lot of other resources out there besides that, but that's just some that come off the top of my head. But they're definitely out there, and you can use them.
Okay, well, you teaching me something. What was that other one? 838-255.
Yes.
Okay, and you can text. That's a textable number.
Yes, that's a
Oh,
textable
okay.
number.
Cool. Okay. I didn't know that. Okay. That's another one I had to add. Now, 988, we actually talked about that last episode with PTSD. You just dial that like 911, just 988. And we did learn that it's not just for the person experiencing whatever is going on, it's also for like the caregiver. If someone's having like a manic depressive episode, someone's suicidal,
Yeah.
someone's whatever the case may be, the caregiver can get some direction from that hotline on what to do. So that was
Yes.
good. So what is one thing you do now that your younger self didn't know was good for your mental health?
One thing, one thing that I had to learn, and it's the biggest thing, is setting boundaries with people. I know y'all touched on that a little bit, but I really had to learn to set boundaries. Like, I don't allow people, like, I could talk to somebody sometimes about whatever they have going on, but I do not allow people to trauma dump. Trauma dump is a big thing, especially if it's repetitive. Like, you keep going through the same thing and you ask me for my advice and then you don't take my advice and then you keep trauma dumping on me. I set boundaries with that. I don't do that anymore. You're not gonna do that to me because it messes with my mental health. And I had to learn that when I got older. I used to let people do it all the time, and but now I can't handle it. I have my own things going on, so I'm going through it too.
Wow. I get that. I get that. I also, for me, I learned that I don't even know how to put it into words, but I learned that not everyone's going to treat you like you would treat them. Like,
True. Yes.
I would be upset, like, okay, I don't know. This is just an example. So maybe at work, I'm always helping you or helping another person, but they don't help me. So now I'm like, why are you not helping me? That's just me, but that's not them. And I was internalizing that and I learned that, very quickly. So I was like, okay, not everybody is gonna, you know, treat me like I treat them. And so that was like,
Yeah.
yeah, that was like another eye opener for me. What about you, Ash?
I would say boundaries too. So how it ain't the trauma dumping for me, but that's a good point. The boundaries with me is I would always put like other people before me. If I'm just like a really, really like giving person, and I would like kind of like put myself last because I'm like, oh, I need to help this person or I need to do this or support this person. So I would say what I do is I read the energy in the room. That's like when I'm going out
Mhm.
with family, if my family having a event, if I'm visiting my grandma, whatever, I read the energy in the room. And if I don't get good vibes, Ashley gonna peace out.
Right.
Yeah. You got to go.
It ain't nothing bad going on. If I ain't feeling it, it could be like everybody laughing. It's just I feel like that's my internal GPS saying we need to go this way. And
Yeah. Yeah.
Totally, for sure, for sure.
Yeah.
I get that. I get that. Well, any last thoughts or last encouraging words for our listeners?
Um. I would say if you're going through something and you feel like nobody is listening or nobody is there to help you, you feel like you don't have the support, reach out to a therapist, talk to that stranger because that stranger could possibly get you through whatever it is that you may be going through. Some people don't have help. Some people don't have somebody that they can go to and talk to. Like I said earlier, I can talk to my mama. Some people don't have that. Some people don't have a bestie, or they might have a bestie, but they're just not the person that they need to talk to. It's nothing wrong with reaching out to that stranger. Talk to that therapist. Call somebody and say, "Hey, I need help." There's nothing wrong with wanting help. Just go do it.
Yep. You can't do it by yourself. You need a village.
You
It
know,
takes a village.
everybody needs somebody. Everybody needs somebody. And people will say that I don't need nobody. Everybody needs somebody
Yes.
for sure.
For sure. Everybody needs somebody, for sure. Because you can't go through this life alone. I've heard that somewhere. Is that like in a song or something? You can't go through this life alone. You need somebody. For sure.
Because this life we're going through will eat you up and spit you out.
Yes.
Right.
I
Yeah.
want to go back to the 90s.
Yes. Also, check on your strong friends. Those be the one that probably need help. They not asking for help. Oh, I got it. I can do it. You never know what's going on behind closed doors. They're probably struggling. They're probably crying, but then outside, they appear to be strong, but they're not. And
Yeah.
also check on yourself.
Yeah.
Take some time for yourself for sure, because you are most important.
Yeah. That's for sure.
Mm-hmm.
I would like to say, it's okay to cry too. Like, don't think that you're soft because you cried. That's healing, and that's it's it makes you feel lighter, makes you feel better, and you can
Yeah.
think better.
Mm-hmm. And normalize the conversation. Normalize talking about your feelings,
Yeah.
because guaranteed you're
Yes.
not the
Even
only
if you're
one
talking to
feeling like
yourself.
that. Right.
Yes. Even if you're talking to yourself. Even if you got to pull up the camera on your phone and talk to yourself. Just
Right.
talk. Get it out.
For sure.
Yeah.
For sure.
If something in this episode resonated with you, send it to a friend and tag us when you do. Let us know how you feel. We might be that stranger that you want to talk to.
Yes.
Man. And start healing, even if it's just with one conversation. You can even comment on
Yeah.
it and tell us your experience. We'll comment back. We'll be y'all friend.
Right.
Yeah.
Exactly. And then, we might be your 988. A lot
Right.
of people normally, just like Angel's mom, that's her 988. Maybe we can
Yeah.
be your 988. Or just listening to the podcast is your 988. This is your sign. This is
Yeah.
us affirming you and letting you know that you are worth it. You are worth to being here. We
You
got
matter. You definitely matter.
you. Yes, your life matters. For sure.
Always.
Always. Well, alrighty. That pretty much wraps up the episode 3 for Minority Mental Health Awareness Month. Our listeners are always encouraged to send us concerns or questions or topics at theher5 at ive@gmail.com. Peace, love, and harmony, folks.